Morning everyone. By the way, let me introduce myself first. I'm Cristina Blanco Orza and I am the reporter of this topic. So before we proceed to our topic, I just want to ask, is there anybody have some idea about this picture? So if you have idea or didn't have an idea, so let's proceed to our topic. So the title for our topic for today is all about communication for nurses, writing basic patient notes. So before that, we need to know the things to consider when having an online class. So first, you need to take down notes. Second, listen carefully. Third, turn on your mic if only you are about to answer. And fourth, click the hand button if you have questions or clarifications. Topic for today is all about communication for nurses, writing basic patient notes. So communication for nurses needed to organize detail gathered from informants. Next, communication for nurses need to write patient notes correctly and accurately. So, speaking of patient notes, what is patient notes? Is there anybody have an idea? So, patient notes is the record assessment of the patient's condition before, during, and after the treatment. These notes can be classified as initial notes, interim or progress notes, and discharge notes. So we already know what is the patient notes. Next, we proceed to the types of patient notes. There are three types of patient notes, which is initial notes, interim or progress notes, and discharge notes. Patient's notes is the primary communication tool to other clinicians treating the patient and a statement of the quality of care. EHR aims to assist you in writing a patient's notes, but in the end, the notes comes from you, the physician or caregiver, nor from the EHR. The patient's notes are the official records of the patient's care. They are the medical legal record of the interactions between the patients and the health service. Keeping good notes helps to develop and maintain a high level of care and pride in the service. There are three types of patient's notes: initial, interim or progress, and discharge notes. Initial notes refers to the first or earlier assessment. So initial notes or initial assessment in nursing are the ABCCS assessment, which means airway, breathing, circulations, consciousness, and safety. It's the first assessment you will do when you meet your patients. This assessment is repeated whenever you suspect or recognize that your patient's status has become or is becoming unstable. Next, the interim or progress notes refer to the assessment reports done in order to monitor the condition of the patients. So interim or progress notes are the part of a medical record where healthcare professionals record details to document the patient's clinical status or achievements during the course of a hospitalization or over the course of patient's care. Review, read the meaning. Next, we have the discharge notes. Discharge notes are the reports given once a medication is discontinued or the patient is released from the hospital. A discharge note summary is a handover document that explains to any other healthcare professional why the patient was admitted, what happened to them in the hospital, and all the information that they need to pick up the care of the patients quickly and effectively. SOAP format is one way of organizing patient notes.
Hi, my name is Rona Imartunya and I will continue the discussion about SOAP and then their definition. S is for assessment given by the family members or patient himself. Like for example, patient mother state her teachers said she can understand her more. O is for objective. Assessment seen by you and reflected in the laboratory on the other medical reports. Like for example, in patient produced in the initial position of words and 70% accuracy given by the cause of tongue replacement. A is for assessment or diagnosis. Interpret the meaning of S and O. Like for example, produced in production of increase from 60% accuracy during the last session and the 70% accuracy during the decision, giving visual cause to tongue replacement P is for producer to done and address the diagnosis. You can intend to do next time, address the client responded. And then, second is 10 nurses communication skill for success. Non-verbal communication, you can communicate a powerful message without saying a word. Or in other way, use multiple channels of communication including your entire body, facial expression, tone of voice. And then on the other hand is a sign of message that we can understand through body language, gesture, and facial movements. Like for example, in non-verbal communication is katong mga amang, di man sila ka-istorya, but true communication nila is through hand gesture or hand movements lang ilang pag-communicate sa uban para ma-express nila ilang feelings. And then second is active listening. Listen to understand, not solely to respond. One of the best principle for active listening. And on the other hand, active listening or best way example na lang in school. One example of active listening would a student waiting their turn and considering that their peer have to say before stating their opinion in the classroom discussion. Sa active listening in school, nag-discuss si sir and then the student is naminaw sa sila. Then after pag humanig discuss ni sir, mga tana, sir, nga unsa inyong na sabtan sa discussion na dito na sila motubag sa ilang thoughts or ilang opinion or nasabtan sa ilang discuss ni sir. And then number 3 is personal relationship. With practice, you can learn to show care, compassion, kindness while obtaining the power, providing information to parents. And then number 4, inspire trust. Always keep your words. Inspire trust in other way. It is confidence born for the characteristic and competence of the person on an organization. And then number 5, show compassion. Treat parents with respect and dignity. Number 6, cultural awareness. Every patient is unique. For instance, the way of greeting for senior is very respectful. And then for other culture, they feel very rude. So while working with people from different parts of the world, important to be aware and communicate norms with values and cultures. And then the next is educating patient. This nurse communication skills is at the heart of nursing. Educating patient, one example of this is one-on-one teaching, demonstrate and analogies and word picture to explain concept. And then next is written communication. This is essential for nurse communication. And then in the other way or other hand, written message can in 2 or more people exchange. Like for example, email, text messages or messenger. That is the best way of communication. Through messenger na lang ilahang pag-istorya, dili na sila mag face to face. Number 9 is presentation skills. Nurse in leadership position are not the only one who needs these skills. In other way, involve organizing your time, using body language, choosing the proper presentation materials, and answering event attendance question and providing audience participation. And the last is verbal communication. Verbal communication skills are the most important. Verbal communication can take place over the phone call, in a face-to-face conversation, or over loudspeaker, through audio recording. Best way of verbal communication is para sa kwa karon nag-report ko sa inyong atubangan. Then naay ni gawa sa mga words akong baaba, that is a verbal communication. And that's it. Thank you.
So that are all the 10 communication skills for success in nursing. First, nonverbal communication. Second, active listening. Third, personal relationship. Fourth, inspire trust. 5, show compassion. 6, cultural awareness. 7, educating patients. 8, writing communication. 9, presentation skills. And 10, verbal communication. So thank you for listening from our report. We hope that you all understand the communication for nurses writing basic patient notes and have learning on it.